I'm Sharon Pushko. I'm the director of Daybreak Geriatric Massage Institute. And I'm just going to tell you a little bit today how we work with the seniors. We all have a lot of seniors in our practice, and we all know if we look at the population around us or at the newspapers or magazines, seniors are growing at the enormous numbers today. Since 2011, there's been 10,000 a day turn 65. So there's a lot of business out there in the geriatric work for us. And when we do the geriatric work, we take some special considerations into the body of the person we're working with, because obviously we all know aging is not a disease, but the body does change as the progress moves on. So when this modality was developed 30 years ago by Dietrich Miesler of Germany, and all the work we do, not just because it feels good, has been studied and researched. So I'd just like to show you a couple of the techniques we use when we're working with those folks. When we work with the seniors, we always start with the feet. So I'm just going to show you a couple of things we do here on the feet and the legs to work with the seniors. When we work with them, we use the Bon Vital Deep Tissue Cream for most of the folks because it's nice and fluid, it doesn't leave a sticky residue. Many of them, if they are in a facility, the stickier creams will get into their clothing, into the bedding, that sort of thing. And this is a wonderful product that doesn't leave that residue for them. So we use just a little bit, and we just apply it. And before we get started, we want to do what we call the foot pump. And the purpose of this is to get the EDRF, the endothelium-derived relaxing factor, flowing, to get the blood flow going before we start the work. And then we do a little work on the foot, which is widening out the plantar surface. Most of them, if they are not very mobile, have tight and stiff feet. So we just loosen that all up, get the foot nice, blood flowing nice and moist. We do a little range of motion very slowly. This is different than some of the modalities where you're doing a real fast move, nice and slow. Remember, they have thin bones, they're on medications, things that could cause something we don't want to happen with the bone. One of the major strokes that we do with these folks, because something that happens to all of them, no matter how healthy they may be, is thinning of the skin. So the stroke we use is called fluffing. And fluffing looks like this. You just squeeze and release, as opposed to doing these long stripping strokes, which can bruise or tear the skin. So it's just a nice little press into the muscle, some deeper than others. Some of them have denser muscles than others, or thicker, denser skin than others. The massage with the senior client is only a half hour long, so we can get a lot done in a half hour that's nice and complete. And then we go on to work with the upper leg, doing a little work on the hamstrings, getting them all nice and loosened up, and a little more fluffing.